Happy Friday, everybody. Hopefully everyone is having a great end of the week, although now the days are blending in a little bit. It's hard to tell. Just got done with a few consultations today. We've had a few patients ask about hairline lowering and forehead reduction. This is one of the few procedures that we super specialize in and we do a lot of. There is many patients that benefit from this procedure. We tend to prefer to do this procedure on women more than men. Although some men are candidates for it, the vast majority of our patients are women. Men tend to lose their hair as they age, and sometimes that makes the scar more visible without hair transplant. So depending on the family history and a bunch of other factors, we try to prefer hair transplants for men. For women, on the other hand, this procedure tends to work much better than hair transplants. People who benefit from this procedure are generally women who don't like their forehead because they feel it's too large. Most of them have not lost hair, and this is just a genetic feature that they have. Now, it's important to point out that there are a lot of women who have larger foreheads, but we still admire their beauty and we consider them beautiful. Some people don't like it because it does make them look a little older, maybe it'll feel like it looks a little masculine. So these are the folks that are the best candidates for it. Obviously, you do have to be healthy and a good candidate for surgery in general. You have to have reasonable expectations. So all those things factor in like any other cosmetic procedure. But if you are a healthy person who does not like the size of their forehead, then you are a candidate for hairline lowering. The incision for the procedure is usually placed in a strategic location in the hairline. It's in the front of the hairline in order to remove all the extra forehead that we do not want, but it is hidden in a special way that allows the incision to heal as good as possible, but also to be hidden, because that's the key to the successful procedure, is that after it heals, is you do not see the incision. And obviously there are variabilities in how patients heal, but the vast majority of patients heal, and even wearing a ponytail, you really cannot see the incision if it's done correctly. This is one of those procedures that are not very common in terms of popularity historically, so there's not a lot of people that do it. It is not the kind of thing you want to kind of experiment with, or there's a lot of nuances to it, and a lot of what we do is not really reversible. So you really want it done well and done right, and in the right hands, this works most of the time beautifully. So make sure you see a specialist who's done this procedure, can show a lot of results, and that way you're comfortable with the expected outcome of what you're going to get from this procedure. There is a healing time, a recovery time, as with any procedure. The recovery time for forehead reduction is usually about 7 to 10 days in the acute period. So that's when things are kind of a little bruised, a little swollen, you have stitches in there. In the long run, it tends to heal really well. People don't really feel comfortable wearing ponytails until the incision is a little bit more visible. So that takes a couple of months. And we help you style your hair a certain way to kind of get through that period. There's a lot of little tricks that we have that we can offer people in order to hide the incision in the initial period. Once it heals, you really can go back to normal, or be exposed to the sun, swim, wear a ponytail, wear hats, all kinds of things that you maybe before did not in the initial healing period were a little bit uncomfortable to do. Okay. The procedure itself, recovery-wise, there's not a ton of discomfort. The first day or two, you might feel some tightness, but really there should not be a lot of discomfort here. So this is something that people usually get through pretty easily with minimal amount of pain medication. So that's definitely another advantage. There's not a lot of complications if you do this procedure correctly. There's not a lot of complications that can happen. Pretty straightforward. But if this procedure is done incorrectly, there's many things that can go wrong, from bad scarring to revision requirement to hair loss to poorly designed hairline to brow asymmetry, even nerve issues if someone's not careful. So Definitely this is something you want to trust someone who's, like I said, have some experience in, and should show some results where the results are pretty aesthetic, and that you feel comfortable getting one of those results and be happy with that. Okay. The last thing is how much to lower the hairline. I think out of all the things I discussed, this is probably the most important factor, both before and after. So discussing with your surgeon where the hairline should be, and which part of the hairline and how it looks and the design is by far the most crucial part. Just lowering it, just with a random number that will look terrible a lot of times. It doesn't fit the face. It all has to be studied and kind of designed and analyzed ahead of time in order to get the result that you want, and keep the proportions of the face normal, keep everything aesthetic and normal and balanced, and so you look beautiful with a smaller forehead. So there's a little bit of tricky business, but that's where experience and judgment comes in. Sets us apart from other practices. I think the way I think about the forehead reduction hairline lowering procedure is, number one is pre-planning. Okay, so during your initial consultations, we're going to look at pictures. We're going to look at you if you're here in person. We do a lot of this for patients from out of state or even internationally. So we start a lot of time with virtual consultation, but with pictures via the virtual consultation or in person, or all these things together. Look at the face, analyze it, see what you need, see what is the optimal way to design the hairline, the shape of the hairline, how much to lower it. What you want obviously is super important. So I always tell folks that you are the captain of the ship and I just help you steer. So you decide, I get your opinion, I get your input on what you want, and obviously I'll advise you and what looks good and what doesn't look good, what I think is too little or too much. But you and I are on the same team. We're going to come up with a plan that you are happy with, that I think would look good in my hands, and then we plan based on that, and I advise you if it's something that is, if you want a specific amount of lowering that I don't think looks good or it's not possible to achieve, then obviously I'll let you know that ahead of time. There's a little bit of game time decision in terms of laxity and things like that, exactly how many millimeters we can advance, but the big picture, the general kind of plan remains the same, and you know that ahead of time, so that's really good. The other part of the procedure here is the post-op care. Here at my practice, you are going to get probably the best post-op care that you can potentially handle. We will follow you up closely. You are in touch with me really 24/7 after the procedure. You're not going to have a question unanswered, or you're not going to have to go to the internet to find answers to certain things that are happening. So you'll be super informed. You're going to be well taken care of. You know exactly what's going to happen, what to expect. There's no surprises. The recovery is pretty predictable, and we get you through this, through the initial period and kind of the long-term healing, and guide you through the whole process, usually without any issues or drama. We do have some results of patients who have had this procedure on their website or even on Instagram, so make sure you follow us and check out our website, our Instagram handle, on Twitter or Facebook. But we have many more photos, obviously, that are not on the internet in general for patient privacy reasons. And there are many more that are not in the office or on the internet for patient privacy reasons. So what you see out there is, a portion of what we have, but it gives you an idea of what to expect if you have this procedure. So if you're interested in a consultation in order to find out whether you're a candidate or find out whether you should be doing this or thinking about this, then highly recommend you contact us either via email or on our website or on our phone, which you can find all that information available on our website, and we'll help you in any way possible to answer all your questions. Okay?